Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, a podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up. Our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system. And frankly, screw that. Sick of it. And it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked with the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode.
All right, everyone. Today we'll be talking to Claire, who is a family nurse practitioner. Currently, she is working at a functional medicine and primary care practice full-time. She's wanting to start a similar practice so she can do her own thing. She's needing help with the startup process, how to transition from nurse practitioner to business owner, and how to market this practice effectively. Hey, Claire, how are you?
I'm doing well. Thanks for having me.
Yeah, for sure. Thanks for hopping on here on a Saturday morning. So, yeah, this is the beautiful thing about being a business owner. You just do whatever you want.
That's
So
right.
Saturday morning and we're recording a podcast. Yeah. So, all right, anyways, tell us a little bit about yourself. Where, how long you been a nurse practitioner for? What sorts of things you've been doing?
Yeah, so I've been a nurse practitioner for 4 or 5 years. I started in a bigger organization and did not enjoy it, but I got my basics there. I learned how to do IUDs and Nexpladons and other like skin biopsies, small procedures, was mentored by some physicians, and then really just wanted to be out on my own and not be under the umbrella of, bureaucracy and kind of set protocols. I wanted to be able to practice medicine the way I wanted to practice. And functionally, I've been able to do that. I think one of the reasons I wanted to talk to you is because I've been listening to your podcast and I understand how the glass ceiling works when you're working under somebody else. And I am definitely curious about how to get out from under that. And also, it's scary and it's a risk. And I know that, it'll pay off, but just kind of wanted to talk through that a little bit more.
So you've been a nurse practitioner for how long?
4 or 5 years.
4 or 5 years. Yeah. And you've been pretty much doing primary care stuff for the most part and some functional medicine now.
Yep.
Did you obtain some functional medicine training or is this kind of just learning on the job sort of stuff?
A little bit of both. I have access to IFM, the Institute of Functional Medicine trainings, and I've done those and kind of learning on my own, listening to podcasts almost every day, nutrition, peptides, hormone replacement. Just kind of trying to educate myself. And then I work with functional medicine providers. So they've been really generous in coaching me as well, which is great.
Okay. Yeah. So you got a pretty solid background here then in terms of wanting to start a functional medicine practice or whatever you want to do. Yeah.
Right. Yeah.
So then you're still working, you haven't started yet. So what's been your biggest hang up?
Well, I think initially, imposter syndrome, the idea of, do I have what it takes to do my own thing? Will I have patients? Will I have a business? And I think that now I feel confident that I will, just with the feedback I've had from my patients and the successes I've had. I think, there's the overhead of wanting to open a space. I think it can start small and grow. So I think from that perspective, yeah, I'd love to talk more about that. But yeah, and then what it takes from your perspective to have a successful private practice with my name on it, I guess.
Yeah. So mostly just fear and imposter syndrome. That's what it sounds like. It's just kind of,
Probably.
yeah, yeah. I mean, I'd say that's probably a pretty prevalent issue amongst most people who want to start a business, not just nurse practitioners, but a lot of people in general, you know. I mean, there's a lot of people out there that, you know, they have some information, they know what they're doing, you know, their skills, their knowledge are pretty valuable, but yet they still have this roadblock of thinking to themselves, "Oh, I can't do that, right? When in fact you can, anybody can. We live in the United States, you can do whatever you want, right? So, within reason, obviously, but you know, you can start any business that you want. So I'd say that, I guess my biggest piece of advice for you is just realize that you're not the only one who has had imposter syndrome, and every single business owner starts from scratch, right? No one's born a business owner, right? I mean, some people are born into families where, you know, daddy owns a business and teaches you some stuff, you know, while you're in high school or whatever. And that's going to be the case with me and my boys, you know what I mean? They're going to grow up becoming a business owner at a very young age. I'm going to teach them these principles and stuff. But most people don't have that privilege. I didn't. Most people that I talk with didn't. Most people who have started billion-dollar businesses started from nothing at all. So everyone is a newbie when they start a business. Everyone has their first business, right? Everyone does,
Well,
unless you just inherit a business from someone. But most people, they have to start their own business. So like, you are not alone in this whatsoever. Everyone has gone through this process, and what separates the people that don't do it and the ones that do it are the ones that do it. They literally just do it. I mean, I don't know what other way to explain it. Like, you just have to take a risk and take a gamble on yourself, because at the end of the day, who do you trust more than yourself, really? You
yeah.
know what I mean? I mean, if anyone can do anything, it's you, you know? So you just have to basically just empower yourself to say, you know, I'm okay. What's the worst that's going to happen here? Like, always ask yourself that question. Like, really, what's the worst that's going to happen here? Right? The worst that's going to happen is that you start a business, you put some money and time into it. Maybe you put $10,000 into it or $20,000. It's a lot of money. It's not the end of the world if you lose it, though, right? And the worst case scenario is the business fails and you have to close shop and you go back to work making six figures.
Yeah,
Like, that's really not that bad of a deal.
that's
I
true.
mean, yeah. So I would say just realize those things. If you realize that, then it's really not a big deal. And you just said yourself that you have patients that love you and that want to see you. So if you own your own practice, it's going to be the same thing, and it's going to be even better because they're your patients and it's your business. You're actually going to go probably even the extra mile. So patients will really, really love you. So I wouldn't worry too much about it.
Okay. The other thing and piece that I work through is like, right now I don't do any of the billing. I mean, I submit my codes or whatever, but I'm not submitting them to insurance directly. And I think that's the piece that I'm nervous about because I've never done it. And I also don't know how I would feasibly have time for that, plus seeing the number of patients that I'd want to see. So I think, yeah, maybe I just need to learn how to do that and see if it's something I can add in. And if you have experience with that, it'd be helpful. Or at what point do you hire someone, and how do you, like, do they have to work full time? Do they have to work the hours that you work, or do you just pay them like 8 hours a week and that's enough? You know, trying to find that balance of how to.
So let's tackle those two things first.
Mhm.
So number one, let's talk about billing,
Mm.
right? So a critical component of starting a practice is, like, before you even start it, like when you're creating the just idea of it, that idea is number one is, are you going to accept insurance or are you going to do cash? So like, where's your mind going?
I think with the population that I work with right now, having insurance would be beneficial. I think that there's definitely room for cash pay in the future. And ideally, I mean, my dream is to have my practice be a part of a business, but not the only piece of the business. And that by that, I mean having like maybe a form of like a sauna soaking situation going on outside of, and my practice being a part of that. And then eventually hiring on other 1099s and kind of recreating what I'm doing right now for somebody
Sure.
else.
Don't
So
be thinking
go ahead.
don't be thinking that far in advance right now, okay?
Okay.
Like hiring providers and stuff, you are not anywhere even close to even be considering that. I'm
Okay.
glad that you're thinking about it,
Mhm.
but I would leave it at that.
Yeah.
Leave it at a thought. That's
Yeah.
literally all it is.
Mhm.
Jot it down. You will be dealing with that problem a year from now,
Right.
okay? Maybe two. Who knows?
Yeah.
Okay. So I wouldn't worry about that quite yet. But in terms of the insurance cash thing, that's something you do need to worry about,
Yeah.
right? So you said that with the population of patients that you see, you feel like you would have to take insurance. Why?
I mean, that's just how it is now, I guess. That's kind of it.
Okay. Yeah. So, many of us are brainwashed in this idea that you have to accept insurance, right? And then many of us, when we got to NP school, we get jobs where we bill insurance, right? And so it's all like you don't know anything else,
Mhm.
right? You only know what you know. And so I had the same issue as well when I first started. The first practice I ever started, I did accept insurance.
Okay.
And I got rid of that headache within 6 months.
Okay.
I was sick and tired of it.
Yeah.
Because when it's your business, you care about getting the collections, getting the billings, charting appropriately, all that kind of stuff. And when it's your business, you will realize how much the insurance companies will try to you over.
Okay.
Okay. And so you'll realize that very, very quickly because now it's your money.
Mm.
It's not the business you're working for money.
Right.
Right.
Okay.
Now you have to go chase those $80, that $100 and stuff like that. You're spending an enormous amount of time trying to argue with an insurance company that you should, that this visit justifies a level 4 visit
Mm-hmm.
and it pays out $120 or whatever. And now you're spending an hour on the phone, submitting paperwork, doing all this bull
Mm-hmm.
to get $120.
Yeah.
Right. And now you've just spent 2 or 3 hours chasing $120.
Mhm.
Okay. It's not worth your time. It's just
Mhm.
not. So I guess the only reason I would foresee that you have to accept insurance is if you're providing a service that is predominantly insurance based. Now, primary care in general is usually more of an insurance based kind of a thing, right? There's very few cash based primary care practices.
Mhm.
If they are, they're typically more like the DPC model, okay? Where they charge a monthly fee and you pay cash for it,
Right.
and then that's it. Those are usually the primary care practices that can get away with it. Strictly fee for service usually doesn't work very well for primary care, right? And then other like specialty stuff. You are not opening up a cash only cardiology practice. It's not going to happen, right? Or a cash only, orthopedic office.
Mhm.
Like it's probably not going to happen.
Mhm.
Okay. Now, functional medicine and wellness services and these kinds of things, you can get away with cash. All right. Now, unless you live in just an absolute impoverished area where everyone lives in tents and trailers and nobody has money whatsoever, then cash practice should work. Okay. I mean, I've even seen cash practices work in the poorest areas. I mean, my first men's health clinic was in one of the poorest counties in the country,
Okay.
and it worked. Okay. There's always people with money. I don't care where you're at in this country. There's always someone.
Mhm.
Okay. Always. So, and even if there isn't a whole lot of people with money, there's still people who are upper middle class who can afford $70 a month Okay. Um, so in my opinion, I really would try to avoid insurance if you can. It adds another layer of complexity to your
Mhm.
business that will it will do nothing but give you headaches.
Mhm.
Okay. And you are seeing functional medicine patients. These are complex patients. These aren't 15-minute visits, right? These are 2 hour long visits. You bill level 4, level 5, I'm sure, for most of these visits, right? You are still not getting paid what you really should command here. Like yeah. You are not getting compensated for the amount of work you're putting into this,
No.
right? Even if you bill a level 5 visit and get $200 for it, that takes you an hour and a half. You were
Plus there's, I'm working for somebody else. So what I'm being reimbursed for, and as a 1099, I get paid for how many I see in a week, or every 2 weeks. And they're taking 46% off the top of what's being reimbursed from insurance. So it's significant. Like, I know,
yeah.
I know
How
that.
much? How much? I mean, if you don't mind, how much do you make
Probably
roughly?
160, 175, which is
Okay, if
good.
it was
Like,
your
I'm happy with that, but I think the entrepreneur in me wants to just see how, like, I've done this. This is a big leap for me to get from a corporate organization who really was not building me up as an NP. Like, they don't value NPs. To jump off into something that felt pretty risky at the time, and it's gone well. And I think that, I want to be grateful for that. And I don't want to like
sure.
rock the boat too soon. And I'm happy with where I'm at, but I'm just curious what else it could look like. And like my boss, so to speak, did the same thing at some point and jumped off and created what I'm working for now. And so it's kind of like, well, if he did that, like, what
Why
would it
can't you?
be provided? Yeah.
Yeah. So just imagine if it was your business, you'd be making 300 to 350 a year, right?
Just off of me. All right, sorry.
Correct. Just
I'm
off.
thinking about, yeah, right. Mm-hmm.
Yeah, just off. You now, obviously, you have some expenses, right? So, I mean, you have to pay for an office space, etc. But you'd still be making more than you're making. You'd probably be making closer to $250,000,
Mm-hmm.
right? So, because I mean, your margin on this should be pretty high. You should have a margin of probably 60-70% with a practice like this because it's predominantly service based. It just really requires your time.
Mm-hmm.
So you shouldn't have a whole lot of expenses. So yeah. So yeah, just realize that, I mean, you could accept insurance if you want to. An insurance-based practice will typically make more money than a cash-based practice under under certain circumstances. Now, with an insurance-based practice and you are a solo provider, okay, you are going to cap out. You can only see so many patients, right? You only have so many hours in a day. So you will reach a ceiling as a solo provider in an insurance-based practice. You will never, ever be able to get past that ceiling accepting insurance. You're just not going to, okay?
Okay.
Scale it by having another provider,
Yeah.
right? That's how you scale an insurance-based practice. But you can scale an insurance-based practice quickly because people want to use their insurance,
Mm-hmm.
and and you're okay with adding those complexities. Insurance billing, more employees, more bullshit,
Right.
right? Okay, so if you go cash, you can scale that to whatever you want. Especially as a solo provider, as a cash-based practice, I know cash-based practices with one provider that does $1 million a year. I know practices that do that.
And
You're
what
not
do you
making $1 million
do?
a year.
Are
Yeah,
they primary care, or are those practices?
mostly wellness service stuff, subscription-based stuff, hormone
Okay.
replacement therapy, peptides, functional medicine,
Mhm.
stuff that scales,
Right.
stuff that grows. So they do $1 million a year and they're solo provider.
Mm-hmm.
Okay. If they accepted insurance, they would cap that at $300,000 a year. They would not, they would not make any more. You can add some things in there, sure, maybe get it up to 400 or 500, but that's it. That's all you're ever going to do. So if you want to scale this thing and avoid headaches, I would maybe try cash and think more about the DPC kind of model, okay, versus fee for service. Now, cash-based functional medicine practices, they will operate under 3 models, pretty much. Model number 1 is fee for service. I see you, it's $200. I see you again for follow-ups, it's $100, whatever. It is a strict fee for service, the kind of thing, right? Number 2 is a subscription-based kind of thing, a DPC, concierge care sort of a thing. You bill $99 a month, and the patient can see you, however many times they want. You can cap that, though, because I'm sure there are some, weirdos out there who have anxiety problems and stuff that want to see you all the time. So you can add stipulations to that, you know what I mean? 1 visit a month for your functional medicine needs, and then an unlimited amount for acute urgent needs via telemedicine. Oh, I got sore throat. Okay, well, shoot me a call. What synergy you got? Oh, you were exposed to strep. You got a sore throat. Okay, sounds like you got strep. We'll send a Z-Pack in. Whatever, right?
Yeah.
Takes you 5 minutes. It's a 5-minute phone call, right? Yeah. Okay, there's that model. And then there's the model where it is an upfront fee to become a member. And that member, you're a member for anywhere between 3 months, 6 months, 12 months. And within that are unlimited visits, these vitamins, an IV infusion, maybe compounded hormones, however you want to structure it. Okay. And that's going to be upfront, like for a year, it's 10 grand. You know what I mean? For 3 months, it's $4,000. For 6 months, it's $7,000, whatever. Okay. And then there's that model. So those are the 3 models. Okay. So it's really up to you on which one you want to pursue. A lot of functional medicine practices that I've talked with, most of them do just the fee for service kind of a thing. Okay, that's what most of them do. But again, it's hard to scale that as a single provider because it's still tight to your time.
Right.
So you want to create a business that scales that isn't tied to your time. That's how you build a scalable business, okay, that has infinite runway to it. And the way you do that are the last 2.
Okay.
That's how you would scale it as a single provider, okay? Because the DPC route, a lot of people are going to take advantage of it. They're going to pay for it, and you'll see them every 3 or 4 months, right? Some people will be a pain in your ass. That's just going to be part of it. But for the most part, most people will not fully take advantage of that membership, okay? And you can just keep taking patients on. You can keep taking them on. You can keep bringing them on, etc. And then once you hit a point where, someone's calling me and they want to make an appointment, and I'm booked out for 3 weeks. Now they're pissed. Now they're canceling their membership. Okay. Yeah, now it's time to bring another provider on, right? Same thing with the other model as well. Okay. So you can do a hybrid of those 2 models as well if you want to. Okay. Do DPC, or you can do, we also have these packages. This package includes this many visits over a period of 3 months. It also includes your hormone replacement therapy and also includes these vitamins. You create different models, a platinum, a gold, a bronze, a silver, whatever. You know what I mean? So you can really play with it and be creative. All right.
So with the compounding, like hormone medications, with I'm guessing that's something that you do with Men's Health, or right?
You're going to want to use compounded meds as much as you possibly can. It's just the markup on it's so much better.
And so would you order those in bulk from the compounding pharmacy of your choice and just have them? Or how would you offer that as part of the package?
I would only order certain things in bulk that I know the majority of patients are going to get.
Got it.
Right. Like methylcobalamin. Everyone gets a B12 shot. So I'm going to order to the B12 shots, right? Like at my Men's Health clinic, we order 30 ml bottles of testosterone because, well, that's what we provide, right? I mean, anastrozole and tadalafil and sildenafil, like these are things that we know most of our patients are going to be taking. So we order that stuff in bulk, but like certain peptides, we don't order that in bulk, right? Growth hormone, we don't order that in bulk, So For your hormones, though, for the most part, you will just be sending a script to the compounding pharmacy and get shipped to their house. Okay.
Okay.
So,
And you
yeah.
spread
So
that
you
on
will,
as a business, like that cost is like what you're saying is that if you do packages where you're saying, this includes X amount of visits plus compounding medications, you're paying for that as a business owner and then just shipping it to them. The patient doesn't ever see the cost of that. Okay.
they never see the bill. Correct. So they have no idea that bottle of testosterone only costs you $15. They have no clue.
Mhm.
Okay. They don't need to know. It's none of their business. They're
Mhm.
paying for the service.
Right.
They're paying for the whole thing. Right. So yeah, so you have to figure out your costs when you create these packages. So as an example, if you want to, create a package both for, functional medicine for men, functional medicine for women, then create different packages within them, then you basically are like, okay, well, the base package is, you're going to get your testosterone replacement therapy or your compounded 3-hormone cream of estrogen, progesterone, and testosterone or whatever. You get those costs from the compounding pharmacy, and you got to make sure that you're accounting for those costs within the price. Okay. So you're striving for a profit margin of all of this. Okay. If you create packages, if you go that route, you're striving for a profit margin of 50% at least.
Okay.
Okay. So that's what you're going to be striving for.
Mhm.
So if you create a package for 6 months,
Mhm.
and you charge, I don't know, let's just call it $4,000 for that package, right? You better make sure 2,000 of that's profit,
Mhm.
okay? At least.
Okay.
And it probably is going to be more than that, to be honest with you.
Okay.
Right? These compounded hormones don't really cost that much.
Sure.
I mean, overall, when you're doing like a package of stuff with peptides and hormones and things like that, usually only cost you $50 a month in cost, and you're charging $150 a month or whatever. Okay. So yeah, so just kind of keep that in mind. So those are really the 3 routes that you need to be considering if you want to avoid insurance. If you're going to go the insurance route, you better start the credentialing process right now, because it's going to take 6 months to have it complete.
Yeah.
So your business will need to be up and running for 6 months, probably.
Mhm.
Yeah.
Okay. But
You go cash if you open up next month.
yeah, it's desirable to not do insurance, but
Right.
it's also a little bit risky. But I hear what you're saying, that there are people that will pay for this, and there are people that want to have a service that is offering them the simplicity of not going through insurance too, because at the end of the day, like, premiums are going up next year. People are already frustrated with their insurance. So yeah, it's up to them if they want to.
Yeah. Yeah. I pay $1,800 a month.
Mm-hmm.
I'm self-employed, aren't I? $1,800 a month for 4 people with a deductible of $12,500.
Yes.
What am I even paying for?
Right.
Like, it's just in case I get into a car wreck.
Yeah. Right. If you had to go to the emergency room. Yeah.
Right. I get cancer or something, like that's what I'm paying for, is the what if.
Right.
That might not happen for 30 more years. You know what I mean? So it's like, yeah, it's a total ripoff.
It is.
So yeah, it is. So, and another thing too to consider here as well is that if you do a cash-based practice like this, you're not competing against your employer. Your employer takes insurance.
Mm-hmm.
So
True.
so you're really not stepping on toes here.
Right.
It's a completely different kind of business
That's
model.
a good point.
Right.
Mm-hmm.
Yeah. So,
I guess
if you want to do,
sorry, my other thought there is like, that's a lot to manage in terms of ordering, seeing it's totally plausible. I think it would just have to be like a population size limit, of like managing people's packages for compounding, plus seeing them as a functional patient. I'm just thinking about having somebody else do the ordering for me, setting up because that takes time. But
listen, it doesn't take that much time. Okay. Someone's paying you for a package, right?
Mm-hmm.
They pay you for 3 months.
Mm-hmm.
As soon as the visit's done, you go to the compounding pharmacy website, click, sign that, and they get the whole 3 months in the mail.
That's true.
That's it. You order it one time. That's it.
Yeah.
Then you're done. Doesn't take much work.
Okay.
It's gonna take work when they refill.
Right.
But when they refill, they're paying you again for another 3 months.
Right.
So it's easy. You follow up with them. You just make that part of your visit flow. You know what I mean?
Mm-hmm.
You could do that yourself for a while. And, the thing is too, is that these patients are going to be paying you a premium,
Mm-hmm.
you know? And so you can take your time and you don't need that many patients to have a pretty profitable practice,
True.
right? So, like, let's just say, as an example, with a general functional medicine patient or some kind of wellness integrative pay patient, you're going to be making anywhere between $1,500 to $5,000 a year off of each patient,
Okay.
right?
That's good.
And that's about probably what you're going to get, give or take, depending on what kind of packages you create, what you're offering, etc. So do the math there,
Mm-hmm.
right? I mean, 100 patients
Yeah.
at an average, yearly value.
Mm-hmm.
I mean, it's 150, 200, $300,000
Yeah.
and 100 patients.
Yeah.
How
Right.
difficult is it to manage 100 patients by yourself? Ain't that hard, right? So yeah, like this is just the reality of it. It's
Right.
really not as hard as you.
Okay. Well, that's reassuring. I had another question. Shoot.
All
Can't
right. Well, another thing to think about then while you're thinking about that question is that um, think about a high level of service here. So you can have the cheap monthly whatever. Okay. That is a concierge based functional medicine practice or integrative medicine, whatever you want to call it.
remember.
Okay. You have this cheap base that's $100 a month or whatever. That's basically visits, maybe give them some B12 shots, give them something cheap,
Mm-hmm.
right? You have that. That's going to get just revenue in the door,
Mm-hmm.
right? Those are very low value patients, though. Those are the patients that you really don't want to focus on because you have to have a lot of them
Mm-hmm.
to make a lot of money,
Mm-hmm.
right? You have a lot of them, okay? If you're charging $100 a month, it's going to take 1,000 patients
Right.
to get to $100,000.
Right. Yeah.
I mean, you know what I mean? Like it,
Right.
yeah. So, well, wait a second here. Um, let's see the math here. I'm going to do some math here just real quick. So, okay. So, like I said, if you have 100 patients, it's $1,000. I mean, or $100 a month at 1,000 patients to $100,000. Right. Now, start doing the math though on what if you have higher value patients
Mm-hmm.
where they're giving you $3,000 a month or $3,000 a year rather, okay? Now, to generate the $100,000, right? You literally only need 33 patients,
Yeah.
right? You don't need very many to generate the exact same amount of revenue
Mm-hmm.
with less headaches,
Mm-hmm.
right? So just be thinking about that. Think about a little bit more higher value stuff, and you just need less patience to make the exact same amount of money and a hell of a lot less work,
Mm-hmm.
right?
Yeah. Sounds really nice.
All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and then other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
Sounds really nice. Because like right now I don't even know how many people I have on my panel, but probably a couple thousand. And I'm responding to email. We don't have support staff. So I'm responding to emails of those patients that are super anxious or whatever it is, strep throat. and I'm seeing about 30 to 40 patients every week. So I'm doing a lot. Like I see patients 3 or 4 days a week, depending, and most of the probably 60% are telehealth. But then I'm responding to patients on email or catching up on charts or getting insurance stuff or imaging stuff every day. I work every day. So,
Right. So out of the let's just say you have 2,000 patients on your panel, give or take or whatever, 2,000 patients. If 10% of those people decided to follow you and pay you cash, okay, immediately you already have 200 patients, okay? That's just 10%, all right? We can even drop that down even more. We call it maybe just 5%, okay? So if 5% of those people decide to follow you because they like you and they're willing to pay you cash, and the value of those people, let's just call it, is $2,000 over an entire year, right? So 5% is 100 people, right? And let's just say that the value is $2,000, $3,000. I mean, you do the math there. You're already making just as much money as you're making right now, working your ass off every single day.
Yeah.
And you have 100 patients to manage. How much time does that take you?
Yeah, not much.
1 day a week. 1 day a week.
Yeah. Yeah, that sounds pretty good.
Yeah. At my men's health clinic, I have never seen patients more than 1 day a week, ever. Never.
Really?
I've never seen patients more than that, ever.
Wow.
Not once. Yeah.
And do you have other practitioners or is it just you?
Well, I mean, I have a lot of practitioners now, yeah, but even like for the first 2 years when it was just me, I still only ever saw patients on Fridays. And it was usually in the afternoon from 12 to 5. That's it. That's literally it. I'd work 5 hours a week seeing patients. Now, add another 5 hours to it, do the bullshit stuff.
Right.
I had a medical assistant that did a lot of the work for me, the busy stuff or whatever, you know what I mean? But I would work 5 hours a week, and within 2 years, I was making just as much money as I was working full-time at urgent care.
Mm-hmm. Did you work at urgent care while you were seeing
Yeah.
5 patients?
Yeah.
Yeah.
I was still working full-time.
Yeah. Okay.
Right.
That's the other consideration is like, at what point do I kind of split time maybe and still do the primary care thing, or do I just full send into cash pay and cross my fingers?
Yeah, that's a difficult question to answer. It's a difficult decision to make. Because you have this buffer, you have this safety net of this salary that you need to live off of, right? So you'd never, ever want to just quit your job and start a business. You never want to do that. So, you look at this business as something that's extremely part-time at first, okay? And you continue to work full-time, and then you focus on your business 1 day a week. That's literally it, okay? So it could be on Fridays or Saturdays or whatever. I mean, you're going to be a busy girl for a year or two, okay? That's part of the sacrifice if you want to avoid debt. You know what I mean? And you want to avoid debt. Don't take out business. I think business debt's the dumbest thing you can ever do. The interest rates are ridiculous, and there's no guarantee on it. When you take a mortgage out on your house, the house is still worth what you bought it for, right? Take a $100,000 business loan, that business can tank, and you're still on the hook for that $100,000.
That's true,
right?
Yeah.
And the interest rates are like 10%. It's something stupid. So, yeah, the way to do this is you just continue doing your job. Start this and do it on Fridays or Saturdays or whatever day you have off. Patients will see you on the day that you schedule them. Okay. You don't have to be available all the time for these people. You don't have to. Okay. At first. And then once the business is generating approximately 30 to 50% of what your salary is, that's when you tell your job, hey, I want to go part-time.
Okay.
Right? Because now, like, you're not taking any kind of financial risk here. Now your business is compensating you for part-time, for half the work that you're doing this other job. Getting a practice like this to $80,000 a year in profit is really not that hard.
Okay.
It's not a difficult thing to do. You should be able to hit that in the first year.
Okay.
Okay. And then once the business is to a point where it's getting close to what you make in, in the part-time job, and now you're sacrificing your business because you're having to spend time over here in this job, that's when you call it quits, because the business is what's going to make you wealthy. The business is what's going to give you your freedom. That job never will. So stop focusing on it and go in on your business.
Okay.
Okay. It's an anxious moment in your life. It is difficult. It's a difficult thing to do. But once you do it, 3 months after that, you will look back and be like, I should have quit that job a year ago. What the hell was I thinking? Like, I've never heard anyone say they regret leaving their job. I've never. The regret that I hear is that I should have left my job earlier. That's the regret I hear. Yeah. So that's how I would structure it.
Okay. I like that. Yeah. I think
Yeah.
I also like having just some things in a clinic space, and it doesn't have to be a big clinic, I think, to start. Just maybe like a room rented in a building or something. And then maybe having some extras, like if it's the B12 shots or something, just to like give to my patient while they're there, to kind of start that relationship and then grow from there in terms of hormone packages or peptides.
That's exactly what you do. You start very, very small. But when you start it, though, you have those packages. You have it all set up and ready to go. Okay.
Right.
Don't start that later down the road.
Okay.
Start it start right from the get-go. You know how to do HRT. You know how to do peptides. You know how to do functional medicine. Why not offer all that at the exact same time? It's stupid not to. Okay. But yes, a very small office. That's $500 to $1,000 a month. Something cheap, Yeah. So that's kind of the way you do it. You just ease into it.
Great.
Yeah. But
I remember
how much
question.
Yeah.
Do you use Quest or do you do your own? How do you do labs?
Do it whatever way you want.
Okay.
Most of these people will probably have insurance, so I usually let them use their insurance for the lab work, because it prices in more people who can pay you cash for the services, and they pay cash for the labs. Then they might not have enough to actually pay you for the service.
Yeah.
You don't make money off the labs; you make money off the service.
Okay.
Right. So yeah, you can just use any lab you want. Here's your lab order. Go.
Yep. Okay.
And then the insurance, and then the lab deals with the insurance. You don't have to worry about it. You just give them an order form, you put some ICD codes on it, etc. But you should also have a cash option though that you can do in house. So you can just create an account with like Access Medical Labs, and they will send you all the lab equipment and the tubes and the shipping labels and stuff like that. You can just draw it right there in your office, drop it off at UPS on your way home, and call it a day. You get the results in 48 hours.
Cool.
Okay. So when you create that Access Medical Labs account, just say you're with the lead MP, so you can get some discount pricing on it. Okay. But yeah, it's a pretty straightforward process. Have you taken any of our courses before?
No.
You never have. I would highly advise taking at least just one of them.
Okay.
Because it's going to talk to you about how to start the business.
Okay.
So like if you know about functional medicine, so I mean you can take our foundational functional medicine course, you might learn some stuff, but the last section of it is talking about how to start the business.
Okay.
Or you can take one of our HRT courses or whatever, and just make sure you take one of our courses that talks about the business components of it, because it will walk you through the process on the compounding pharmacies and lab work and getting an LLC and doing all this other stuff.
Great.
Okay. So
really helpful.
It's worth the $400 or whatever it is. Okay. Like it literally give you a blueprint. I'm not trying to sell you on. It literally just give you the blueprint on what you need to know. Okay. And then question for you though. It's just something I thought about. So you are a 1099 employee?
Correct.
You have an LLC that it pays?
I have an LLC, and that's been something that I haven't quite set up yet. That's my 2026.
Okay, so the 1099 is paying you directly?
Correct.
Oh, no. Absolutely not. My Lord, you are throwing away money here. Okay. Get an LLC. Okay. You can get an LLC formed in 24 hours.
I have
Just
one.
go to, okay, you already have one. Okay. Then go open you have a bank account with it yet?
No.
Okay, go to a bank and get the bank account opened up.
Okay.
That's literally all you have to do.
Okay.
That's it. Now you have an LLC and a bank account. Okay. Go to your employer and say,
Pay me this.
I don't want to be paid anymore. I want my LLC to be paid.
Yeah.
They're going to say, okay, it's whatever to them. They don't care. All right.
Mhm.
It's filling out one form. It's nothing. Okay. All right. Now you have all the money that you're making going into an LLC account. Okay. All that money is tax free
Mhm.
right now. It's sitting in a bank account under your LLC. It is free from taxes. You then use that money to start your practice. Everything that you do through that LLC to start this practice is a 100% write off. Okay.
Great.
That's what you need to be doing. All right. Like you need to be tax efficient here. It'll save you 30, 40%. I mean, it's going to save you a significant amount of money. If it's just paying you, then you transfer money to the bank, to an LLC and stuff. Then there's a bunch of other stupid laws with writing off business expenses that you have to deal with. Don't deal with that. Just have your LLC paid and then just start the business and start writing that off. Your rent, the furniture, a computer, all of it.
Okay.
Okay. It's a business expense now. It's 100% write off.
Okay.
Starting this business. Okay.
Wait, so you said so that step is a write off to start the business using the LLC money, but then I also should pay myself still, right?
Well, yeah, you still need money to live off of,
Right.
right? So yeah, so just take out whatever you need to live off of.
Mhm.
Leave as much as you can in that bank account so you can operate your business with it. Okay. So you might need to go a little lean for a little while. Okay. Be a little bit more frugal with your money, be a little leaner. That's just part of the process. Uh, and then once your business starts making money, the money will then start coming in that LLC.
Mhm.
And now you don't have to really worry too much about it. Now it's paying for itself.
Okay.
Right. But continue to have your 1099 job pay that LLC still. Keep doing that.
Yep. Okay. Perfect. And then this is more of an aesthetic question, but or like a branding thing. If my LLC does the LLC and the business have to match in name?
In most states, no. You
Right.
just do a DBA,
Okay.
just doing business as.
Okay.
In most states, you don't even need to register the DBA. You just do it.
Okay.
That you have to check your state's law to see if that, what's applicable or not. Yeah. So just check that. But yeah, I would, if you have to register a DBA or if the law is a little kind of ridiculous surrounding it, then you can always just go form another LLC. And I mean, it's only a couple $100. It doesn't cost much, so you can do that, or you can just do a DBA. So basically what you would have to do is that your name, the branding on your website and all that stuff will be the DBA. And then at the very, very bottom of the website, you actually put your LLC name there.
Okay.
And then like on all the consent forms and stuff like that, it would be this LLC DBA, the name of the business.
Okay.
And then for the rest of the consent form, you can use either LLC or the DBA. Doesn't matter. You just have to identify that to the patient. Be transparent.
Okay.
Yeah, that's it. That's all you
Okay.
gotta do.
Makes sense.
Yeah. So I think that what you really need to be thinking about here is how you're going to package your services as cash based. What packages do you want to offer? What things do you want to offer within those packages, and really come out with a variety of different packages. Now, you don't want to create 20 different packages, then it complicates it. It's
right. Just
confusing
like
patients.
5 minutes.
Keep it simple.
Yeah.
Yeah. Make it like 6 different packages and leave it at that. Okay. So think about what you do from a functional medicine standpoint and what services and what meds that you typically use, and create packages, and then do an HRT one, and, keep it relatively simple. And you can always have a little a la carte menu where
they can add.
Okay. Well, if you want growth hormone or you want a peptide, it's this.
Right.
That's the price.
Okay.
Yeah. You just basically 1.5, 2x your cost on it. Just general rule of thumb.
With HRT, and I do think I'll probably take that course, but I function with HRT very personalized. And so I'm thinking about the packages and how I would do that. And maybe they're still personalized. Like they're not set dosages per package, but it's just like you're getting these hormones and then I figure out the correct. Okay. So that's what you're saying.
Yeah, don't have dope like, well, with this package you can get 100 milligrams of testosterone. With this package,
Right.
it's 150 milligrams of testosterone. It's this
Don't
much
do
more.
that.
No, no, no.
Just your
It's the same price.
okay.
You have a woman's package, a men's package, a functional medicine package. You want to try to keep this as simple as
Right.
possible.
Okay. That's
Okay.
smart. Yep.
Yeah. Some patients will be at a higher dose.
Right.
You will make a little less money with those patients compared to the ones on a lower dose, but it's not going to be it's not going to impact your profit margin
Mm-hmm.
significantly. You're talking about $20.
Mm-hmm. Okay.
Yeah.
Cool.
It's not
Yeah.
a big
That
deal.
makes sense.
Yeah. Yeah. Um, and then I think one thing you want to talk about too was marketing, right?
Oh yeah.
So, you said you talk about transitioning from NP to business owner. Do you have any questions with that?
I think there are steps that will take care of that. Like the things that we've just talked about in terms of what does the overhead look like? What do the packages look like? Is it cash pay? Is there any insurance? Like I think that transition will happen kind of naturally when I step into the role, which I think is what you kind of said in other ways of like people leaving their business or leaving their job and never looking back. And I think that will happen
Yeah.
organically.
No, it should. I mean, you will like you become a business owner. You're just not a business owner. You become one.
Mm-hmm.
Uh, One thing that you need to make sure that you separate between being an NP and a business owner is the care aspect. Okay. You are an NP when it comes to the medicine component.
Mm-hmm.
Okay. You are not an NP when it comes to business. Okay. You have to throw out, I hate to say this, but you got to throw your heart out a little bit when you're in terms of being a business owner.
Mm-hmm.
Okay. Like, these are the prices. This is what it is. Oh, well, can I get 50% off? I'm having a hard month. No, you can't. Because then I'm working for free.
Right.
Right. So you have to kind of throw your heart out a little bit when it comes to being a business owner. Okay. You can put all your heart into the care. That's
Mm-hmm.
fine and you should. But the business component of it, you're going to have to get out of your head with that. Oh, is this right? Am I doing the patient wrong by charging this much? Am I like, it's going to go through your head. Okay. Throw it out. You are a business owner. Your goal is to generate a profit.
Mm-hmm.
That's how a business runs. That's how it survives. If you're not generating a profit, you're working for
Right.
free.
Right.
Right. And I'm sure you'd rather go on a hike. You know what I mean? Like, yeah. So just make sure you make it separate those two things out. It is a separate thing. Okay.
Any tips on how to do that? Because I feel like we are like inherently givers as
Yeah, it's a process. You just have to keep telling yourself that, like, I can't be too nice
mm-hmm.
when it comes to the business part of it.
Mm-hmm.
You know, you can, the more you bend the rules for patients, the more it will happen.
Mm-hmm.
Okay. So if you start giving this person over here a discount, you'll start giving more people discounts.
I know.
And you'll start bending the rules and bending your pricing. And you can't run a business that way.
Yeah.
Like, most people who start a practice will bend the rules a little bit at first just because they want some patients. They need to get some people in the door. They need to generate some revenue. So, like, it is okay to do it a little bit at first just so you can get some patients in there and start making some money.
Mm-hmm.
But you have to stop doing that at some point. You're going to get patients to say, oh, well, I don't want to pay for that package. Well, and why can't you just send the hormones to Walgreens? Because we don't do that.
Yeah.
You just have to say no. Like, this is what it is. If you can't afford it, then okay, I'm sorry. Like, you can go somewhere else.
Yeah.
Or you can go our $99 a month package here for care.
Right.
You know what I mean? No.
Okay.
So,
you would never.
So
just a quick question about that. So if you've set up HRT packages, men's, women's, whatever, and then you have a patient that's doing a $99 a month, but you know that they would benefit from hormones, you would not prescribe them through their pharmacy.
And okay, and that was literally exactly what I was getting ready to say next. So I'm glad you were thinking the same thing.
Mm-hmm.
So Yes, the $99 a month, you can't finagle your way into this and think you're tricking me.
You just
You
say,
know,
it looks like you need hormones. This is the way we do that here.
this is the way we do it.
Yeah.
Oh, well, then why can't I keep paying you $99 a month and you just prescribe it to the pharmacy?
Well,
Because
then
I don't do it that way.
okay.
I don't do it that way. I'm sorry. I'm happy to call your antibiotic in. I'm happy to call in your blood pressure medication or whatever. You know what I mean? But like, no, those packages you have those packages for a reason, right? It's to generate revenue. That's how that's how you scale the business.
Okay.
Yeah. You have to have a clear line and be strict when it comes to the DPC kind of stuff and the packages. You don't deviate, don't mix them.
Okay. That's a good thing to think about. And the other thing I was thinking about is that, inevitably things become more expensive with inflation and everything that happens over time, but also scaling your business. Like, not that I wouldn't be thinking about doing this within the first year, maybe not even the second year, but when would you, or do you increase the prices of the packages ever?
No, I don't. It's not necessary. Like the pricing that you set when you first start, stick to those prices. Okay. You only need to increase the costs when your costs go up,
right?
With inflation or whatever. Now, the prices that you set when you first start, okay, those aren't necessarily set in stone. The initial 3 to 6 months with a business like this is very experimental.
Okay.
You will change the prices around a little bit. Let's just say, God, 90% of the patients just say this is too expensive. Well, if you're getting that kind of feedback, maybe you should drop the price a little bit. You know what I mean? You have to maintain that 40 to 50% profit margin, though. Okay. 40% minimum. All right. Never get below 40% margin, because if you do, you stop making enough money to make this worth your while. Okay. So come into it with a margin of 60, 70%, and then you can drop it down to 40 if you have to.
Okay.
All right. But you probably won't. You'll probably settle in around 50% or so, or you might not have to change your prices at all. You never know. But yeah, so don't worry too much about that.
Okay. Great. So marketing, I'm thinking about location in the city as an important piece of that.
Yeah, for sure. I mean, your location matters. Absolutely. So you got to focus on the free stuff first. I talk about this probably in almost every one of these podcasts. With your Google business listing, I mean, that is just something it's not negotiable. You have your Google business listing, and you make sure the name on that Google business listing clearly states what it is that you do, right? Blank integrative medicine, whatever, hyphen, functional medicine, direct primary care, HRT, whatever you want.
Okay.
Have your website. Make sure your website clearly explains what it is that you do. Don't put a bunch of, rainbows and unicorn stuff on your website. Make it crystal clear on what it is that you do. Don't make people guess.
Okay.
People don't care about a bunch of fancy, fun, progressive language. They don't care. All right. The simpler the website, the better, as far as I'm concerned. Okay. So make it crystal clear what it is that you do on that website. All right. So, you spend a little money on a website. AI tools out there to make websites for you now for nothing. Right. So, have a website, have your Google business listing. People who are searching for this stuff will find you. Okay. And you're going to go into this slowly. Okay. Like, you're not wanting to open the floodgates as soon as you open this practice up. So you don't spend a bunch of money marketing this thing. In my opinion, what you should do is I would probably spend nothing on marketing at first.
Yeah.
All right. I would utilize the resources that you have in front of you. Now, I'm not telling you to poach patients from your business, from the practice that you work at. Okay. Don't do that.
Right.
That's solicitation. You can get in trouble for that.
Yeah.
All right. But it is okay every once in a while if you have a patient, you can say something along the lines of, hey, just FYI, I did open this practice up over here. You're more than welcome to come see me over there if you want a little bit more of a higher standard of care or something like that. But don't actively solicit patients.
Yeah.
Hey, you know what I mean? Hey, I opened this other practice up over here. Why don't you follow with me over there? Don't say shit like that.
Yeah.
Okay. Yeah. But you can mention it to some people here or there.
Who might be
right?
interested. Yeah.
Yeah, exactly. So, and then any kind of other resources that you might have in the community, other referral sources, other places that you go to, whatever, local Facebook groups that talk about specific healthcare topics and stuff. You can go in there, start contributing. People will start coming to see you. You know what I mean? So I wouldn't spend a whole lot on marketing at first.
Yeah, it makes sense.
Okay. Yeah. When you get to the point where, let's just say you're not generating a whole lot of leads, you're not generating a whole lot of customers or patients and that kind of thing, let's do another podcast.
Okay.
Talk a little bit more specifics there in terms of marketing. But my advice to you over the first 3 months is I would not spend much on marketing at all.
Okay. Makes sense.
Get a good website, get a good Google business listing, utilize the resources, bootstrap stuff, okay, at first. Do that first. So it gets people coming in the door. They tell their friends, little word of mouth starts, all right? You might see 4 patients the first month.
It's okay.
Fine.
Yeah.
It's okay, okay? At my men's health clinic, I think we saw like 4 or something like, I don't even remember now, like 7 years ago, but like, I remember we only had like a few patients. And then the second month we had like 10. Then then the third month we had like 15. Like, it gradually snowballs.
Okay.
All right. This is a longer game.
Yeah.
This is not something short.
Yeah.
All right. So that would be my advice for you. If you want to put a couple ads out there, you certainly can. A Google search ad works pretty well. Someone looks up functional medicine in your area, maybe a Google search ad for that keyword would be that bad. Someone searching for hormone replacement therapy in your area, a Google keyword search ad might not be a bad idea.
Yeah.
But if you put those services on your Google business listing, then your Google business listing will show up on the map.
Right. Okay.
And that's where most people go.
Right.
Yeah. When you look for a new restaurant,
totally.
You go to Google Maps.
Yeah.
Yeah. So utilize Google Maps, like put your Google business listing out there. And if you got to throw a few kind of bullshit reviews on there at first, so be it. Okay. If you treat family and friends for free, I know I do. Dude, listen, man, I've been prescribing you this for a year. You have 5-star review.
Yeah.
You know what I mean?
Fair.
Yeah. Okay. Use that. All right. Get some reviews on there. You need to get as many reviews as you possibly can on that Google business listing. That's what's going to rank you on that map.
Yep. Okay. Awesome.
All right. Like I said, let's do another podcast on marketing though. Get the thing open first.
Yeah.
And then 3 or 4 months, now let's talk about some more specific stuff we can do.
Great. I'm going to do the HRT training as well. I think that'd be helpful.
Yeah. Yeah. And like I said, it'll guide you through the business process of it too. So, you have any other questions?
I think that's it. Thank you.
You're welcome. It's a pretty solid episode. We talk about some good stuff.
Yeah.
All right. Well, at the end of the episode with you asking me a question.
Okay.
Personal question or a curiosity.
Do you have a sauna?
Yeah.
Okay. How often do you use
I was literally in it about
I thought maybe that was the case because the way our emails went.
Yeah. Yeah, I was literally in my sauna 2 hours before our call.
Okay.
So what I typically do, my morning routine, and I try to do this every morning. So I recently started intermittent fasting protocol, and I feel great. Like it is crazy how well it works. Yeah. So my feeding window is from 1 to 2 o'clock in the afternoon till about 7.
Mm-hmm.
Outside of that, I consume 0 calories.
Are you drinking coffee in the morning?
Little coffee, I use some coffee. I got a fucking bad habit with some nicotine pouches, but whatever. Yeah. I use a nicotine pouch with some coffee, and then I'll drink some water or whatever, all 0 calorie, right? And then, so what I typically do in the morning is, it's crazy. I started this intermittent fasting about month and a half, 2 months ago. And what I'm finding is that I wake up at like 4:30, 5 o'clock, full of energy. Like I am just up. I'm not groggy, nothing. And I usually will sit down in front of my computer. I'll work a little bit for an hour or two, and then I work out. I got a gym downstairs in my basement, and I mean, I got a power rack, a treadmill, an elliptical. It's kind of ridiculous, honestly. Free weight set and all this stuff.
Great, you're not wrong for
Uh,
me.
I don't go to the gym. Screw that. I mean,
Yeah.
I'm 41 years old. I'm too old for that. I'm too old for a gym. I ain't going to a gym, hanging out with a bunch of 20-year-old punks. Um, yeah. So then I work out. I'll lift or I'll do cardio or stretch and do some ab stuff, core stuff, whatever. And my sauna is in my gym as well. So then I
Nice.
work out and I go straight into my sauna. Now I have a sauna that's infrared, red light, and some electromagnetic wave kind of thing that's on the
Nice.
ground.
Yeah.
Yeah, so it's like a full thing. So I get in there, I put a red light mask on too. So it looks ridiculous. Yeah. I got a red light mask on. I'm sitting in this red light sauna, and I'm in there for 40 minutes. So I try to do it. I try to do it every day, but just some days I just don't have time for it. But I do it at least 4 days a week.
What about a cold
And
plunge? Any contrast therapy?
I just go stand outside.
Okay, fair enough. Yeah.
Same thing.
Rough day, yes.
Yeah, it's in the morning, so it's like, I mean, I live in Colorado, so like I will literally, so I usually will do the cold before. I usually do the cold first thing in the morning. So I'm like, when I wake up, I'll let the dogs out and like I just go out on my porch.
Yep.
I just take my robe off. So I'm just standing in my underwear on my porch, and I'll just sit there and try to endure it for like 3 minutes. And so I just do that first thing. Yeah, I cold plunge. I can't do it. I can't. Yeah.
Okay.
So
Some people can't. Yeah, some people can't. I definitely.
I just can't do it. The cold air is fine. The cold water I can't do.
Mhm.
So I do my sauna, and then I get out, rinse off all the toxin, take a shower, and
Start your day.
start my day. Yeah.
Are you changing what you're eating while you're fasting? Like on the eating window, have you been eating as much gluten or carbs, or have you cut that out? Do you eat those things? I'm just curious about the wake up time being so much. I know that intermittent fasting, because you're filtering and you're processing, you're giving your gut time to break things down or remove excess and toxins. But I'm also curious about that 4:35 a.m. wake up time in correlation with what you're eating.
Yeah, so it's interesting. So I'm 41, and once I hit 40, I've really begun to notice how food makes me feel. Like in my 20s, you can eat whatever you want. You know what I mean? 30s, pretty much eat whatever you want. But then you start kind of noticing some stuff as you start getting in your mid to late 30s. You're like, well, I feel like today. Wonder. Was it that pitcher of beer and that pizza that meal last night? Like,
Probably.
you know what I mean? Yeah, probably, right? But then 40 hit, and I realize now, I'm like, man, if I eat anything super carbohydrate, like really high in carbs, sugary kind of a thing, within just 2 to 3 hours before I go to bed, I feel like the next day, like feel like so. And I've also developed some like this weird gut stuff lately. I'm not too sure what's going on there, but I've cut out dairy as well, and it pretty much kind of fixed the issue. So I'm not really doing a whole lot of dairy. I'm not really doing a whole lot of sugar. So it's mostly like very high protein meats. I bought half a cow. So, I mean, I eat a lot of beef, chicken, salmon, whatever, veggies, fruit. So I mean, I still eat. I was eating clean before, but with the intermittent fasting now, I still try to eat fairly clean within that window. But what I've noticed is that about 1 o'clock comes around, and I'm really not that hungry.
Yeah.
Like I have to kind of force myself to eat. I'm hungry around 8 or 9 a.m.
Right.
And then after that, like right now, it's 11:20 Mountain Time. I'm not hungry whatsoever. So I'm going to have to force myself to eat at 1. And what I've noticed is like, I can just get away with just kind of eating like a rabbit at first.
Yep.
You know what I mean? And then I eat a pretty good dinner, and then I'm done. Yeah, it's great.
Your metabolism has shifted to be able to do that. Yeah, it's pretty amazing the body can adapt so quickly. I mean, it probably takes maybe 2 weeks comfortably to get to that point, but it can happen within a number of days too.
It can, yeah. For me, probably about 3 or 4 days. So
Yeah.
I started feeling pretty comfortable with it. Yeah.
Mhm.
And yeah, like I'm super lean now. Like it's crazy. Like within a week, I had 6-pack abs. I'm like,
It's super effective. I am as
this
wild.
is super effective. You know what I mean?
Mhm.
So like I was 185 pounds and now I'm hanging out about 178. I'm just maintaining. Yeah. So now I
Good.
am on testosterone and nandrolone, but
Well,
whatever.
yeah. But that's for other reasons, you know. Yeah.
Just for other reasons. I'm
Yeah.
41 years old. That was it.
Yeah. Yeah.
Yeah.
Cool. Well,
So
thank
cool.
you. Thank you so much. This was really fun.
You're welcome. Holler at me. Holler at me in a few months if you want to do a marketing podcast. Okay.
That sounds great. Thanks, Justin.
Cool. All right. Take care.
Bye.
Bye. I hope everyone enjoyed the episode with Claire. Lots of really solid nuggets in that episode. That was probably one of the better episodes we've done in a while. She is in the startup phase and she's asking the right questions. She's going through what I would say the normal jitters of starting a business, right? Getting over the imposter syndrome, not really knowing where to go, getting out of these mindsets of kind of how the healthcare system brainwashes you, right? Accepting insurance, thinking that you have to see patients, thinking you have to exchange your time for dollars and these sorts of things, right? So I think she has a really good idea. I mean, I think that functional medicine with packages and DPC and that sort of thing can do very, very well. So I'd be really curious to see what happens in 3 or 4 months. But realize that when you start a business, you want to start a business that's scalable, guys. Okay. Exchanging your time for money for every single thing that you do is not a good way to scale a business. All right. If you start a practice that requires your input for everything that you do to make money, you are creating a business you're going to become a slave to. You're becoming self-employed. All right. So you want to start a business that's scalable. You want to start a business that works for you. And you do that by having packages, having subscriptions, having memberships, that kind of a thing. If you do fee for service, it's always going to be tied to your time. And if you accept insurance, it's definitely going to be tied to your time, unless you have other people seeing patients for you. All right. So if you're starting a business, you're wanting to take your business to the next level, you want to scale your business, keep that in mind. If you are fee for service or you accept insurance, you are going to cap out what your revenue potential could possibly be. So keep that in mind. All right. Talk to everyone later. Thanks. Bye.
Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.